Age-related macular degeneration, also known as ARMD, a letter for each word. Okay, it's called age-related because hey, it's associated with time. The older you get, the better chance you have of getting it. Now there is a genetic component to it as well. So if Grandpa had it and Dad had it, and there's a chance that you might get it too. All right. So to explain this, there's a couple different forms: a dry form and a wet form. I want to draw out this picture of the eye here and its parts. The way light works is light's supposed to come in and focus at a point in the back of your eye called the fovea. If light focuses there, you should see 20/20 or better. The fovea is part of an area called the macula. All right, and the macula is part of the full tissue back there called the retina. The retina is more peripheral viewing. All right, so what happens in macular degeneration is these little bumps start to grow inside the macula. Okay, they form, and those bumps are called drusen. If the drusen form, well, the macula degenerates. That's where we get the macular degeneration part of it. All right, so if it's macular degeneration from drusen alone, we call that dry macular degeneration, dry ARMD. All right, then later on, after that degeneration happens, you get these blood vessels that can grow inside there, causing bleeding and scarring. All right, so these new blood vessels that lead to bleeding, all right, that can happen all of a sudden. You get a blood break, you get blood all over the place. We call that wet ARMD. Okay, wet macular degeneration. That's the most serious one. Okay, we don't want to ever get to that point. The early form tends to be dry, later wet. Okay, so anyway, these drusens. Let's start with what usually starts first. You tend to get this drusen. They're associated with positive charges in the blood supply called free radicals. Okay, so if you've got free radicals, well, they tend to form these drusen. All right, so we don't want free radicals in the body. All right, so let's talk about the contributors first of all to free radicals. Well, what contributors, so these are bad. We don't want free radicals in there. Worst thing that you can do is smoke. Smoking increases positive charges. Poor health, meaning if you're unhealthy or if you make bad health choices or poor food choices, those are all bad things. So be healthy and have less free radicals. Good choices to reduce free radicals is don't smoke. All right, do things like exercise. Be healthy. Okay, do those things. Those actually help you. And eat healthy. What we want is antioxidants, okay? Because antioxidants will reduce positive charges in the body. Antioxidants are like vitamins C and E and the carotenoids, all right? Carotenoids are like lutein and zeaxanthin. And there's a vitamin out there called A-Reds too, okay? And the way I like to remember that is if you remember the Cincinnati Reds and the Oakland A's, A-Reds, the two teams, okay, that's a vitamin combination that'll give you some support or some supplement to macular degeneration. Okay, so remember the wet ARMD is the bleeding. Okay, and if you do have bleeding, if it gets to the point of bleeding, what they do is they stick a needle in your eye. All right, if you if you actually do get to that point where it starts to bleed, and they inject this it's called anti-VEGF, which stops the bleeding, stops the blood vessels from continuing to bleed. So you don't want to ever get to that point. So try to